Hi, I'm Dr. Kevin Cheng, founder of Osana, a health service dedicated to transforming lives through prevention. Over the years, I have reflected with colleagues on what we wish people did so they can avoid pain, surgery, or developing a chronic disease. Often the answer lies in embracing a proactive mindset and putting healthy lifestyle practices into action. By doing this, the upside is not only better health, but also saving us time, money, and stress in the long run. In this podcast, I'm joined with my friend Saxon Piggott to chat with a new health expert each week. We'll cover practical ways to look after ourselves, how to prevent illness, and ways we can be inspired to live well. Welcome to Prevention Hacks, the weekly conversation where we go to health experts for advice, so you don't have to. Welcome, Dr. Chris Quirk, to Prevention Hacks, which is our community podcast. And it's wonderful to have you on this podcast talking to us about preventative cardiology. So thanks so much, Chris, for your time.
Thank you for having me. It's a pleasure.
So I might kick off and wanted to ask you about how much of heart disease or cardiology is preventable, because there's a big focus on lifestyle conditions these days. And we have this mantra of getting in early. Prevention is always better than cure. What are you seeing in terms of the evidence and the opportunities for preventing?
Look, that's a very good question. And I would have to say up front that I'm not sure that we know the answer to that. To some degree, and bear in mind when we're talking about cardiac disease in this instance, we're talking really about atherosclerosis. Obviously, other issues, genetic conditions, valve disease, they're probably not influenced by anything other than genes or the environment. So we're talking about atherosclerosis and atherothrombosis, the typical, which is the commonest bread and butter thing we have. How much we can predict? We generally believe that we can predict probably 90% of people's heart disease. In other words, are they going to develop it? I tend to say to patients, look, if I had a crystal ball, could I predict whether you're going to develop cardiac disease? Well, we don't have a crystal ball, but our crystal ball that we have is family history, cholesterol, smoking, blood pressure, diabetes, diet, sedentary lifestyle, and those sort of things. And this is really in answer to your question, with the greatest, in my view, the greatest impact being family history. I believe all disease is a complex interaction of genetic susceptibility and an environmental factor. So, for example, you could have a very strong family history, all your ancestors, fathers, brothers, etc., had a heart attack or coronary disease in their 40s. You know what? These are the most difficult patients I have. They have a strong family history. They have normal cholesterol. They had not smoked. They exercise. And, you say, look, the chances are you're going to get cardiac disease. By undertaking a healthy lifestyle, there's a good chance that you will postpone that, but the likelihood, because the genetic influence is so strong. Conversely, you've got people like George Burns who can smoke 60 cigarettes a day and do whatever you want, and they'll live till they're 100 because they're genetically stoical. I often use the analogy of skin cancer. If you take dark-skinned people, they have a low incidence of skin cancer. And it doesn't matter how much sun they get. But if you look at albinos and blondes, you know what? I'm sorry, buddy, you're likely to get skin cancer. So that's a similar analogy. Having said all of that, you can have a major, obviously you can't alter genetics. So we have a major input with risk factor management. And that's the conventional cholesterol, blood pressure, smoking, exercise. Some people would argue diabetes is non-modifiable, or type 2 diabetes is non-modifiable, cholesterol is non-modifiable, blood pressure is non-modifiable, obesity. I would strongly disagree with that. I think nearly all those factors are tremendously modifiable with lifestyle, with preventative measures, which is what we need to try and do. Unfortunately, despite the evidence being very strong, not just from the point of view of metabolic parameters, but from the point of view of actual reduction in heart disease in people who are more active and greater incidence in heart disease in people who are less active, probably less than a third of people in Australia undertake any activity whatsoever. It's estimated in America that 250,000 deaths per year are completely preventable by lifestyle measures, by exercise. So it is a very frustrating thing for me. I mean, I think I've been sort of preaching this for 26 30 years now, and it is almost like smashing your head against the wall from the point of view of prevention. But if I was to give you an exact answer, I would suggest that probably, and this is the pessimistic side of me, probably no coronary disease is preventable, but it's certainly eminently delayable. In other words, are you going to have a coronary event when you're 50 or when you're 85? And that's a major impact. So really, lifestyle is the number one thing to do.
So that's definitely worth pursuing, right? The fact that we can delay the onset of those symptoms, and by the time you get those complications, we've seen patients and their quality of life. Once you get heart disease, people's quality of life really changes. You get tired, you have restrictions on what you can do. And so looking at those modifiable risk factors, as you say, for atherosclerosis, which is really, for those who don't know, it's the plaques in our arteries. Right. That's a huge opportunity. And I noticed that as a cardiologist in your practice, you have a big focus on exercise. So what would you want people to do before they come to see you, which is often late in the piece? What are 2 or 3 things that you want everyone to think about?
Look, it is often late in the piece, but a large proportion of my work at the moment is primary prevention, is screening. Either patients who have got family history who are they're worried well, or patients who've just got hypertension or cholesterol with no underlying heart disease. So as a preventative strategy, and obviously they're the people we'd really like to get on top of early. But it's not too late. So those are patients you're trying to prevent atherosclerosis, which, as you mentioned, is plaque. But man lives with atherosclerosis. These patients can live forever with atherosclerosis. It's not a big deal. It's atherothrombosis. It's when you develop plaque rupture. And exercise is also equally as important in patients who have established, probably more, in patients who have established heart disease for a whole bunch of metabolic and physiological reasons. What I would like to do them before they come and see me, well, it's a difficult question to answer because I think there is the worried well, and exercise can be dangerous. We need to guide people about what type of exercise and what intensity of exercise to do, and sometimes that's only going to occur once you've established that they don't have any occult coronary disease. What I'd like to see everybody do is to sort of reprioritize their lifestyle. The excuses I get, I'm too busy, I've got to drop the kids, that sort of thing and everything. Reprioritize lifestyle with at least an hour of activity a day. And that's sort of seems difficult for a lot of people, but it's actually pretty straightforward. That is the priority of everybody's day. And I would suggest that probably, well, certainly less than a third of patients do that adequately. And of course, then you could digress and talk about diet, et cetera, but from the point of view of exercise, an hour of activity a day is just worth its weight in gold.
What kind of activity are we talking about? Is it going for a walk, or do you need to break a sweat? How much activity do you need to do?
That's also a good question. When I was a junior doctor, the sort of recommendations for people was that you do 20 minutes of walking 3 times a week. I suppose it's the old saying, how long's a piece of string? It needs to be tailored. If we've got a 90-year-old or an 85-year-old who's just had a heart attack, I'm not going to tell them to go to the gym and break into a sweat and go for a run. So then you tailor that, and probably a walk would be adequate. I do believe every day. I do believe something should be done every day. From the point of view of what level, the modern era is we have Garmin watches, we have smartphones that tell us every step that we've done and every heart rate thing. I'm not too fussed about that. I actually don't like them. I think the guide for everybody is breathlessness. So if you get somebody who walks and they say, well, just stride up the hill, get yourself a little bit breathless. That's what's putting a bit of more effort on the cardiovascular system. That's what's doing you good. Sweat you can't use because in the middle of summer you're going to sweat, in the middle of the winter you're not. So I think breathlessness is the go. From the point of view of somebody who's clearly not got coronary disease, they might have come to see you when they're 40, 45, family history, and you want to do some more preventative strategy, then I would suggest a more vigorous exercise. Really sweating, depending on the circumstances, breathless, getting yourself fatigued, and I wouldn't put any limit on them. But at that age group, I think just going for a walk doesn't really cop it.
Are there any warning signs Are there anything that people can look out for? Is it when this event occurs, when you have an issue, then it's sort of it's like a waterfall event, or are there things people
From
can
the
be
point of
looking
view
for?
of, are they unmasking any cardiac disease?
Yeah, if someone's prone to have a heart attack, but maybe they've never had the checkup, maybe they avoid going to the doctors. Like,
Yep.
if they're suddenly at risk, are there any warning signs that they should be looking out for
Look,
that maybe?
look, classically, of course, is chest pain, but basically any exercise limitation. So, we see a lot of patients with vague symptoms of this, that, and the other, and they're sent to the cardiologist primarily because the GP or the referring doctor is concerned. And I mean, it's much easier for us because we're specialists and we're sort of seeing them as a second opinion. But often you can look at them and say, Blind Freddie can tell you this is not cardiac. Now, the trouble is, if you're having rest symptoms, as in having a heart attack, all bets are off. But from the point of view of ongoing, daily, reproducible symptoms, essentially exercise limitation, usually because of chest pain or excessive breathlessness. Some people have excessive fatigue. Anything that you think, okay, this is not right on exercise, is a warning sign. But the classical one is chest pain. And then you've got what type of chest pain. You know what? It doesn't actually matter. Obviously, we talk about classical central pressure, left-sided arm, jaw, etc., etc. In my view, it doesn't matter. If it's reproducible on exercise, that is the warning of cardiac pain. I've had patients over the years that have come for physio and they've had chiropractors on their back because, and I said, when is it? It only comes on when I go for a walk, doc. Now, it could be arm swinging, okay, but that is angina till proven otherwise. So I think that's a really important message for people. Just to digress a little bit, 2 years ago, I was sort of involved with one of the over 35 soccer teams here in Lane Cove, and they had 2 heart attacks that year, both resuscitated because we have defibrillators on the edge of the field, ended up in North Shore. And then I was in a meeting at the hospital, and we talked about the fact that patients need to be educated because in retrospect, both these people had symptoms leading up to this. They described it as indigestion. They weren't quite right. They had a non-specific feeling in the chest. Both of them had those symptoms beforehand. And the argument or the comment was, we need to start educating patients about what warnings, as you've asked, what warning signs to have. And I knew these two situations, and I also brought it up, sadly, that actually it's not just the patients we need to educate. We need to educate the doctors because both of these guys had seen GPs beforehand and had been dismissed as angina, as indigestion. And subsequently went on. So very often, even though a heart attack and subsequent death still probably occurs, or still is probably the first manifestation of coronary disease in about 25% of patients, despite all our technology, stenting, but still the commonest presentation is a heart attack and sudden death. But in fact, if you look at a lot of those cases, they have had some prodromal symptoms beforehand. So I think education to all of us and being attentive to those sort of symptoms. So that's why that question is such a valid one, is really important.
Screening and checking your heart health seems to be an important part that we can embed in general primary care and in community, Chris.
Absolutely. Now, the problem with that is actually what do we do with that information? And you may or may not know, I know you do know that, CT scanning has become a widespread sort of, I shouldn't use the word pandemic, but thing that everybody wants to do now. And I heard just last week that since Dean Jones' death, it's now been suggested that everybody has a CT scan. I just think this is a really dangerous way forward because what do we do with that information? You could argue it may influence you with regards to how aggressive you are with risk factors, et cetera, but we should be aggressive with those risk factors anyway. So I think that's going to take a whole bunch of well people and turn them into cardiac neurotics. So screening is important, but the predominant decision-making about cardiac disease is dependent on symptoms and demonstrable ischemia. It's not dependent on plaque per se. So that's why focusing on people's symptoms, plus or minus a non-invasive test, I think still is the easiest and the basic way to go. But symptoms, warning, and I often say to patients, not only is exercise really good for you, it also acts as an early warning. So if you've gone for your walk every day and you've gone up a certain hill, and after a year or two you think, I'm just not feeling quite right at the top of the hill, you're going to know about that before the couch potato. So it has a double benefit.
Do you have any advice about our tendency towards sedentary behaviours these days, sitting down, office desk work? I read that in the 45 and up study in New South Wales, you're accumulating cardiovascular risk, every hour that you're sitting in a desk job. And
Absolutely.
you might be able to mitigate that, by going to the gym and doing your hour of exercise every day. So it's the positive activities is important, but also it's mitigating the other risk that occurs from just sitting.
Absolutely. And I mean, obviously these things are really difficult to quantify and put into clinical studies, but in the old days, farmers went out on the farm. People didn't have remote controls. They had to get out of their car to close the garage door. We had to get up to change the television. All those things have gone. So the if you like, the passive lack of exercise during the day is very important. There are moves. Some places have these stand-up desks. Even having what they call high-low desks. Even having stand-up desks, your core muscles are engaged. You're more active. Some very sort of obsessive people, although obsessive is probably the wrong word, can have these with exercise things underneath the desk. If you're having to stay at the desk all the time, then there are things that you can do. But you know what? If nothing else, COVID has taught us that actually we don't have to sit at the desk all the time. Productivity is much better, and that's a lot of large businesses around the world having put gyms in their offices. And you might say, why would we put a gym in the office? We want our workers to work. But if you get some workout, you're both mentally and physically more alert, and productivity goes up. So to me, it's a no-brainer. Yeah. And then simple things, and you guys know as well as I do, you can go into the city, you can go into the building, you can go into a hotel, there's the lifts right in front of you, and I go, where are the stairs? These are sort of things we need to change around. The stairs should be there, and you should have to look for the lifts. Lifts are important. We obviously need lifts, but we need to change our whole way of life towards being more physically active.
Yeah, I can't help but think that a lot of the advancements in society around driving productivity, such as someone told me the invention of air conditioning actually helped a lot of countries, particularly in the tropics, just become more productive because they could stay in the office and just sit there and work. I can't help but think that a lot of those productivity gains have a downside to that in terms of how active we are.
Kevin, I don't mean to, my kids always say, Dad, you're just a miserable pessimist, but I truly believe the technology that we have available is going to be the downfall of society from all aspects, from the social media, the computers, that sort of thing, from the driverless buses, from the driverless planes, et cetera, et cetera. We're losing, the human being is losing its need to use both its brain and its body. And that's a real downside to me.
It's also losing its role. Everything's being automated.
Correct. So then we can move into the other, that's a good lead into the other benefit of exercise, which is mental health and self-satisfaction with having a role to do. And, that doesn't have to necessarily be, you don't have to be the prime minister or a doctor or anything like that. Just having some role in society is really important for mental health. And, I truly believe that physical, the best antidepressant in the world is physical exercise. I often, I do a fair bit of kayaking, and I'll often see people down the river and how are you? And say, oh, good, just getting my daily antidepressant. But still trying to persuade people to follow that is extraordinarily difficult.
What about coffee? Is coffee bad?
Can I refrain from answering that? Look, as well as I do over the years, if we go back, eggs are good, eggs are bad, chocolate's good, chocolate's bad, coffee's bad, chocolate might not be, coffee bad, maybe it's not so bad. I don't believe coffee's bad. I think its main potential role is in blood pressure. If it's more of a stimulant, it can put your blood pressure up. But from the point of view of cardiac disease, I don't think it's particularly bad. If we're going on to diet, obviously there are some well-established lifestyle measures from the point of view of diet, such as the Mediterranean style diet. But even more important than that is obesity. And this is another area that exercise has an enormous role to play with regards to obesity. Having said that, and I'll often say to patients, who say, I can't lose weight, I'm not going to do any exercise. I say, well, look, don't be despondent. In my view, you're far, far better off being overweight and going to the gym every day than a skinny little runt who sits on his backside all day. So exercise, I think, weight is important, but exercise I believe to be more important.
Saxon's managed to ask a coffee question for most of our podcasts. It's a very loaded question.
I would be interested to see what because look, a lot of
I'm
these
doing
things
research.
Hey?
I'm doing my own research, just validating my own life choices.
See, the other thing, and I'm very mindful of this, and this is again a pertinent point, is that at the end of the day, we're here for a good time. Okay, so if there's things and pleasures in your life you want, you need to make that decision about whether that's worth doing. But exercise negates a lot of life's pleasures. So if you get a good bout of exercise in day, to some degree, what you do the rest of the day with your good diet is less important, because you're being active, and if you like, you're paying back. You're paying back that indiscretion.
How do we, because you've been plugging away, Chris, for, as you say, 30 plus years, we understand the benefits of exercise. It's so compelling. But as you say, Americans, Australians, our activity levels are low compared to recommendations, where we're all gaining weight. 2/3 of Australians overweight or obese. How do we make this change, either through the health system or in society?
Yeah, look, it is tough, and I have some ideas. Going on from that, we're aware that over 1/3 of children sort of under the age of 17 are obese. So it's something that's got to start right at the sort of embryonic level, if you like. And that obviously starts with parenting and schools. And obviously there are moves around the world for diets to improve at a younger age. Focusing on exercise, look, this is a really, really difficult problem, because, there's no point in me talking to people who like exercise. They like it. If you like something, you do it. If you don't like exercise, it therefore by definition is a chore. If it's a chore, you will not maintain that chore. You might be conscientious, you might have all the willpower in the world, and you might do it for 6 months, but you won't continue. Let's face it, the whole premise that personal trainers exist is because people don't have the willpower to do their own exercise. So that's something that we need to instill. And part of my sort of thinking over the past 20 years is I can't get people to exercise. What I need to do is teach them how to exercise and how to enjoy exercise. And I'll often say to patients, I say, look, you give me your body for 6 to 12 months, I will transform your life. And obviously that involves dieting, weight, exercise, but it also involves teaching them how to enjoy exercise. I can't tell you how many people I see and they say, oh, I live there. I said, well, just go for a walk, find some hills, whatever, join a gym. I'm not joining a gym, can't stand gyms. I said, well, go for a walk. Why can't? I said, you're retired? Said, yes. So why don't you get in your car and drive to Balmoral and walk around there and then enjoy a cup of coffee? So people don't think about it. So some of it's education, but we need to teach people how to enjoy exercise. We have harbors where people can go kayaking. We have lakes. And somehow instilling that, not just go to the gym and do an hour exercise, come with me and I'll teach you how to enjoy it. It's not going to work for everybody.
Gyms are boring, for me anyway. But it sounds like really we should be looking for experiences, right? Something to distract us or enjoy while we're doing it.
Yeah, so this is not just when we talk about diet and we talk about exercise, we shouldn't really just use those two words. These words. It's lifestyle. We need to instill a change in lifestyle to people so that it becomes part of their life. If you like, they're getting the endorphin buzz, they're feeling better, and they just feel better. The surprising thing is, not many, I have to say, but over the years, I've had patients who are very obese, they're breathless, this, that, and I've gone through, we've checked in, I said, look, this is what you've got to do. And they've come back a year later, and I've said, how are you? He said, I've lost 25 kilograms in weight, I'm exercising every day. And I said, how do you feel? And they said, I feel fantastic, Doc. I'm so grateful, I feel fantastic. I've never felt better. Fine, all good, job done. And then they rock up 4 or 5 years later and they're obese, and they're breathless, and they come in and I go through my notes and I go, didn't you do all of that 4 or 5 years ago? And she said, yeah, but I just let it go. So even having had the experience of benefit that gives them, a lot of people drop out of it. And there lies the problem, because it's a chore. If it's a chore, they won't continue to do it. So somehow we have to instill in that it's fun, it's part of life, which gets back to some degree to Kevin's comment earlier. We then need to make their ordinary day more active, because it's got to be a bit of both.
Yeah. I know you, Chris, you trained in the UK, but also lived many years in Spain.
Yep.
Do you see in Europe or other countries, other cultures, do they do this better? Like,
no.
Are there other groups that we should learn from?
No. I mean, the thing, I don't believe so. I mean, the UK is terrible. The thing about Australia and exercise, and everybody knows around the world knows Australia, it's an outdoor country, everybody's blonde and fit and surfing and all this sort of stuff. But we're a nation of extremes. We do have, 10% of the population that are just exercise addicts. They're out there, they're walking, it's beautiful. But then we have the other extreme where people do nothing. So I don't know of any noticeable difference between the UK and here at all. From the point of view, probably worse overseas, because it's just not as conducive for 6-7 months of the year to go for a walk. And although I said before that I'd like more exercise, in the absence of anything else, it's a linear curve. Anything is better than nothing. Yeah. Anything. And that gets back to how we target these patients, where you need to make it realistic. If somebody comes in and say, buddy, you've got to go to the gym for 2 hours a day, they're going to walk out and they say, that guy's crazy. So you have to target it to them. If they're clearly, I'm not going to do that. So, well, why don't you start with 3 times a week or something like that and build up to it? But I don't believe the UK is any better. I think this is Western society.
Yeah, and it's a challenge all around, and I quite like some of the interesting ideas that people try though. In the Middle East, I think Abu Dhabi was giving out gold bars for families to lose weight and do squats before they get on the train, and I know Singapore tried this. They gave tax breaks for people to join the gym, so using kind of financial levers and rewards in some ways, but ultimately it probably has to come down to intrinsic motivation for it to stick, as you say.
It has to come down to that, but I do like some of those ideas. In fact, when I was thinking for quite a while, in fact, that's why we met, Kevin, to setting up my own cardiac gym. We are financially driven as human beings, and you can do that sort of thing. I would like to see, first and foremost, some incentive to go to the gyms and use them. Of course, not just being a member doesn't count, but there should be some incentive from the government or health funds that you use. You join a gym and you go to the gym, and you have to show proof that you've gone it. So that incentive. Then you've got things like, it's a win-win for everybody, and it's been in the press lately, actually, bicycle lanes. Let's make it conducive for people to cycle to work. So businesses having showers, changing, making timescales. But it's got to be safe. We've got to have a safe environment. There's no point in trying to cycle down Pacific Highway or Military Road or something like that. It's not going to happen. And that's a slowly evolving process. I believe in Holland, obviously it's much flatter. And certainly when I was there many years ago, it's just full of bicycle lanes. Everybody cycles there. So it is doable, but it requires a major infrastructure. And the problem is, it's just not going to happen because of the way our system works. Admittedly, it's better than the USA, but we have a government come in here who suddenly turns around and says, right, I'm going to close off 1 lane of every road. We're going to make a bicycle lane, and every single one of your businesses is going to have a shower. Well, 4 years' time, they're going to be kicked out of government. So it's just that's part of the problem. But certainly making it conducive to exercise with some financial gain. I mean, Bupa, MBF, if they had any sense, they'd be saying, right, your premiums, whatever it is, $30 a week less or $100 a week less, but you must go and use the gym.
It's funny you should talk about it, because I heard something last week about from some macroeconomics podcasts that I listened to about central bank digital currencies, and one of the things that they reckon that it's going to happen is they're going to weave in behavioral economics once central banks roll them out. So what they'll be able to do is start controlling interest rates and personalizing them. So they'll be able to say, well, this demographic gets a break, gets a reduced interest rate on their repayments or an increased interest rate on their savings, and it would all be about rewarding behavior, which sounds a little bit scary and big brotherish, but it also there could be gains for society.
I think it's, look, I think something has to change to do this, and we are financially driven and reward driven. I suppose one comment to make, despite all our negative, or my negativism about lifestyle and exercise and that sort of thing, and cardiac disease, and there are many reasons for this, but the life expectancy is going up. The occurrence of coronary disease and everything is going down, or getting later on in life. So whilst I'm pessimistic about all these lifestyle measures, we are doing fairly well. And in fact, from the cardiac point of view, we've only talked about cardiac disease because I'm a cardiologist, but we can't forget, as I said, the impact on mental health. And from the point of view of exercise and obesity, the impact on knee replacements, on hip replacements, on musculoskeletal problems is probably more of a burden than it is on cardiac disease. And that's just overwhelming, the impact that weight has on musculoskeletal problems. And that's as much of an issue as cardiac disease.
Absolutely. I mean, it's so broad, the implications. If we get this right, we could reduce the burden of health, in many ways for so many Australians.
But Kevin, in answer, going back to that, it's the kids and the teenagers, and the amount of people. And I often use the comment to patients, they're overweight and that sort of thing. He said, "Oh, yeah, no, not too bad." I said, "Okay," and obviously it varies. "How heavy were you when you were 21, when you left school?" And so, "Oh, no, I was only 70 kilograms." I said, "Well, that is your weight. There's no reason it should change much beyond that, but 90% of patients it do." So there's some, that I suppose, are we going to succeed with the 50, 60, 70-year-old who's overweight? Probably not. We really probably those teenagers, schools, going forward from there. And I think that's where the lifestyle and the businesses and that sort of thing can really play a role.
Yeah, absolutely. And we're seeing a lot of corporates, organizations mobilize towards better health, especially this year. I mean, I can think of Qantas loyalty points for recording better sleep and data. Health insurance.
They're probably all recording better sleep at the moment. They're not.
Yeah, absolutely. But there still has to be. I like one of these studies, which is around a few intervention groups that look at diabetes and weight control, where you pay people to lose weight or to manage their sugars better, or you pay clinicians like GPs like yourself to manage their diabetes patients better. But the group that has the most compelling results compared to control is no financial rewards, which are granted important, but just to think about non-financial levers as well, is the group that has just a buddy. So another person or patient that's gone through a lifestyle change, as you say, that this person can connect with, build a relationship with. They might just go have coffee, each week and chat, but it's that kind of ongoing support. It might be mental health that actually goes a long way as well.
Well, this is really the concept, and I have to say I never even heard of it till a couple of years ago when I was trying to think of a strategy to take my lifetime ambitions further. Is the concept of a life coach, and a tailored life coach to that person. It's not necessarily a spouse or a friend, or a personal trainer or someone who goes through. So not just you turn up and do half an hour's exercise with me. We go through this together. I think absolutely that's the way to go, and that's really why I started to think about saying to patients, "So you give me your body for 6 months or a year, but you got to do what I tell you." And I'm going to try and tailor that to make it enjoyable. So we'd go from the controlled exercise to build it up, to go up to Narrabeen Lake and let's go kayaking for a day, to go away for a weekend and just go on walks. So it's a whole lifestyle transition. I couldn't agree more. Difficult to set up, but I think absolutely. And to some degree, that's where we're going wrong, because our lifestyle coach for the 14, 15, 16-year-old should be our parents in our school.
Exactly. Well, this is we should talk more and run a pilot. I think is so that's tremendous. Look, we're almost out of time. Perhaps the last question might be just looking forward into the future, Chris. What would the experience for someone with heart disease or risks of heart disease look like in 5 or 10 years' time? What do you see coming with research and the direction of cardiology that might change what we do?
Look, we obviously have had major advances throughout this from the point of view of technology and devices and new drugs and everything. But I have to say, I'm not aware of anything more on the horizon, which is all the more reason why lifestyle is such an important thing. I really think, we've focused too much on, okay, we can do a primary stent and we can preserve myocardium and we can do a bypass operation. I think we really have to say, look, we're pretty damn good at this and we're pretty damn good at spotting them and getting them early, but let's stop it happening in the first place. There are some weight reducing drugs around. There are bariatric surgeries becoming much more acceptable. I would like to think that the roll forward is non-surgical bariatric therapy, which is basically weight loss approach. And the main move in that area is this concept of fasting and exercise with that. And I'm a strong believer that a fasting diet, low carbohydrate diet combined with exercise is the way forward. And that's becoming more acceptable, even by prominent people in the community. And I think that's the way forward. We've got to deal with obesity.
Yeah, that's tremendous. So reinforces the need to get in early and focus.
Absolutely. Well, it's still doable. I mean, obesity is entirely manageable. It's been failed over the years with, the likes of Jenny Craig and Weight Watchers, just doesn't work. So now we understand the physiology of insulin resistance. Weight loss does work if it's done properly, but more important is, or easier to stop it happening in the first place.
Yeah, absolutely. Well, Chris, thank you so much for sharing your thoughts, and you've got wonderful ambition that's aligned with what we're trying to do, and look forward to working on some pilots together. That's
okay. I look forward to it.
Yeah. Thanks so much, Chris.
Thank you, Kevin. Thanks, Jackson. Take care.